Hey, I want to give some case updates for you Medicare beneficiaries out there on some of the things that are coming through our office. And so here's just a list of cases that we work on in terms of the Medicare insurance clients that we service and try to help and make sure that they're put in a better position. So one of them, well, we got a call in from Alabama. It looks like Medicare Advantage only. This happens to be a veteran and I believe on TriCare for Life. A lot of veterans and TriCare for Life folks, specifically that live on fixed incomes, they can reduce their Medicare Part B premium through what's known as a Medicare Advantage only plan, which means Medicare Advantage that does not include prescription drug coverage. If they're on TriCare, they can enroll into Medicare Advantage, reduce their $185 Part B premium. Sometimes it pays almost the entire or reduces the entire Medicare Part B premium to just a few dollars. So that's currently a case we have right now that we're working on. I believe she's a subscriber, so let me know if you're out there. And we're also working on some folks that are on original Medicare. So for you folks that have the red, white, and blue Medicare card and you use it when you go to the hospital or the doctor's office to check in, then you know that you do not have dental, vision, or hearing benefits with original Medicare. That's just the way it works. Obviously, if you have Medicare Advantage, dental, vision, and hearing, typically some type of cover, some of those types of services are included in Medicare Advantage plans. But with original Medicare folks, you folks that use your red, white, and blue Medicare card, have a Medicare Supplement card, that Medicare Supplement does not offer dental, vision, and hearing benefits because it's designed to work in tandem with Medicare A and B, that red, white, and blue Medicare card. So if you have Blue Cross Blue Shield, United Healthcare, Aetna, Cigna, Mutual of Omaha, Medicare Supplement Plan, Medigap Plan, and it says Medicare Supplement Insurance on that ID card, that's for Medicare A, hospital insurance, and Medicare B, medical insurance. Does not have to do anything with dental, vision, or hearing. So with that said, pardon me, you can get a standalone dental, vision, and hearing policy for an additional premium to cover all three of those, to have three coverages in one, essentially. So if you want to know more about that, please comment or call into our office at Medicare Savings in Charleston, South Carolina. We'd be happy to help. Another case that we're working on right now is someone that is needing expensive dental procedures, crowns, extractions, anything that's under major services, orthodontics procedures. A lot of folks don't necessarily go with dental insurance, but I can tell you right now that in certain situations, when you have a large amount of dental procedures coming up and it goes into the $10, $11, $15, $20,000 range, and you know that's what the cost is to you as the out-of-pocket cost, then dental insurance, especially the type that we are providing in-house or are contracted to offer, really helps out on year 2 after you've been on the policy for 1 year. So typically a lot of dental plans, they do have initial coverage, maybe 5%, 10% on major services, but the one that I'm talking about, if you want more information on that, it jumps up to 50% and then 30 and 60% on years 2 and years 3. And so that can be a big help to you, especially to help mitigate those large out-of-pocket costs to you. If it's a $10,000 bill, $15,000 bill, my dad has had, I think he's told me that his mouth is worth over $20,000, and I still think he's missing, even though he's missing some teeth. But make sure that you have the information on dental plans that offer major coverage and help on major services that you have coming up. Okay, the next topic and case that we're working on is those folks that are on original Medicare, the red, white, and blue card, and then the Medicare Supplement Insurance. So Medicare Supplement Insurance is priced in 3 ways. It's either community rated, age rated, or issue age rated. And so that's specific to your zip code in your state. And so each state has Medicare rights and insurance policy and Medicare and Medicare Supplement Insurance rights. And so basically when each state prices it within one of those 3, just know that however they price it, Medicare Supplement has continued to stagnate in terms of people going into Medicare Supplement. More folks are going into Medicare Advantage because they are offered all-in-one benefits under one ID card. But for those folks that have a Medicare Supplement that want to keep their Medicare Supplement, I implore you to shop your rate. I've been helping beneficiaries since 2016 literally lower down their $300, $400 Medicare Supplement premium with those big carriers that you know about down to market value rates and saving folks thousands of dollars. And if you don't believe me, I have YouTube videos to prove this, to let you know that you can health qualify to lower down your rate for your Medicare supplements 12 months out of the year. You do not have to wait for an annual enrollment period at the fall or the beginning of the Medicare Advantage open enrollment period. You can literally shop your rate 12 months out of the year. So if you've seen your rate increases or haven't shopped your Medicare supplement, within a few short years, you are overpaying, and that's called duration of coverage. It increases over time. Okay, the last 2 things are for those new folks that are calling into us, whether you're turning 65 or you're retiring and transitioning off your group health employer plan. In order to know the steps and to make it easy on yourself, we created a resource called www.startmedicare.us. It's literally 3 specific situations that help you, the beneficiary, step by step in knowing what to do to sign up for your Medicare benefits without being hassled. Obviously, you can do this online and go at your own pace, and you can save it along the way, and this is how to do it. So go to our free resource used all across the US called www.startmedicare.us, and that literally helps folks sign up for their Medicare, whether it's Medicare A or Medicare Part B, whether you're aging into Medicare when you're turning 65, whether you're transitioning into Medicare if you've been disabled for 24 months or longer, or the third one is whether you've been you're retiring and coming off your group health insurance. And the last one, I think, is whether you are late to your enrollment on your period where you're supposed to enroll into Medicare but may have gotten a late start. And so go to that free resource from us. Let us know if you have any questions along the way. We have some support for you on that website. And then the last one for our new members, we're constantly gaining new members. You can go to MEDICARESAVINGS.us to become a member, and members usually come to us in the beginning, in the middle, like spring and summer, so that way they can plan accordingly and have it very simple and easy process for Medicare and Medicaid beneficiaries at the end of the year, when all the commercials are happening and you're trying to figure out and discern what's best for you. We literally have a community for you. We literally have members that have been with us for years. And so if you're new to Medicare or don't have anyone to advocate for you and you want to have some lifetime benefits, in addition to having licensed agents to help you shop your rate or help you shop your plan, please go on to www.medicaresavings.us and click on new member help. So if you guys have any specific questions about claims, how to get connected with the carriers, as a new member, you get advocacy from us. We have a team of Medicare Savings member service support team that literally help you along your Medicare journey. So we understand dealing with the insurance companies is not so straightforward. Filing claims is sometimes different for each carrier. Making sure that your premiums are paid on time, making sure that the process to know that your Medicare Part B is being paid. We have the link for you for that. We also have a way for you to get connected to 1-800-MEDICARE, the 24-hour hotline that's open 365 days out of the year, and a tip for you to get in contact with a live agent if you need that type of help. But for the most part, our member services team is able to help with most issues. If you're filing a complaint, you'll call 1-800-MEDICARE. If you are needing someone to be an advocate and have access to your Medicare on Medicare.gov, you'll need to call 1-800-MEDICARE. So there's a number of different things along the way that could be an issue, but we try to make it nice and simple and easy for you, the Medicare beneficiary, or the family member that's helping a Medicare beneficiary along the way. So let us know how we can help. We're down here in Charleston, South Carolina. We'd be honored to be of service to you throughout the U.S., wherever you call us from. Take care and God bless.